do, and that's something that was briefly touched upon by the earlier panel. So we have multiple departments, and we have the latest department, the medical sciences and technology. And with all this, we create a cohort of people, and faculty, of course, are the pillars of this, who have really strong expertise. Then there are centers, HTIZ, then the Brain Center, which is relatively new, and then there are other COEs who convert the science into technologies, and in some cases, places like HTIZ, which take the technology all the way into the public. So many IITs do the first two parts quite well, right, in terms of doing research, and in some cases converting into technology. But what IIT Madras has really cracked it is how to take these technologies all the way into people, because in healthcare, that's the ultimate measure. So this is something that you'll all be, some of you may already be aware of. Till date, the technologies that have come out of IIT Madras have reached close to 2.5 crore patients, both in India and abroad. And these are quite stunning numbers by themselves. But what is interesting to notice is some of these actually have become global products. For example, the 2 eye examination cameras that have come out today are exported, right? Not just to, typically it starts with Southeast Asia and Africa. And today, these are products that have reached the US market. So instead of going through each of them, the cross-cutting theme that you will see, which I want all of you to sort of celebrate in one way, is you've all been part of it, because in each of this technology, you will realize there is a group of medical institutions that have come together to work with us. And there is industry, which is commercializing these. And the gap between when you want to translate something, there's a huge amount of piloting that's required, which is usually the hardest part to cross. And that is where CSR and philanthropy has played a significant role. For example, the mobile eye surgical unit that today is operating in 3 states, and it's going to scale in a major state, you'll hear about it very soon. That happened because there was a lot of philanthropy that supported this, what you call piloting, but not piloting inside a lab, but piloting in the field. Right? So that's the hardest part in healthcare. And today, it is perhaps the only technology in the world that can do a very, very high quality cataract surgery. That in fact, it has 0 infections after running for almost 12 years across, 300, 350 places in very, very remote areas. And this has happened because of this, what I would call a partnership between IIT Madras, the clinical ecosystem, the industry, and the not-for-profit CSR philanthropy. And over a period of time, once we started tasting success, it has actually grown the Indian medtech industry, which itself is somewhat at its infancy, actually, if you think about it. Right? Today, healthcare technologies, or particularly medical technologies, is today a 1,20,000 crore kind of market. And some of you may know this, but for people who, you may be very surprised, 90% of it is imported today. So just reflect on that number. So there's still a long way to go. And I'm very happy to share with you that the work that IIT Madras has done is till date generated a cumulative revenue of few thousand crores over the last 5 to 10 years, domestic industry. Right? And that's something that not only have we reached people, we have actually built capacity in industry to do that. And now, because of that, we are now able to create very, very complex products. I mean, these are extremely complex. Endoscopy is one of the most complex medical products that you'll ever see. It has 300 moving components, right? Because you're literally putting an electronic tube inside the human orifice. I mean, you can imagine the safety and the kind of work. And today, we have literally pioneered the endoscopy market in the country and the endoscopy industry in the country. And today, there are 5 endoscopy products that are in the market out of IIT Madras Technology. So, and Secretary Krishnan had just left. So the last one that you will see, it is a robotic surgery system for spine, and today we are making something for knee replacement. Right? Today, the only way you can get that is through import, and it's about $1 million, $1.5 million machine. Right? And quickly, almost every major ortho hospital is now having that machine. Right? So if you don't have these indigenous technologies, not only is it a balance of payment problem, it's also something that you don't have capacity. And then you'll end up in the same situation like various other sectors, right, where you're completely dependent on the thing. So here, this is the first indigenous robotic surgery system. It's entering the market, and MeitY is supporting it, and a lot of other companies have supported. So this is one flavor of what I wanted to share. The other flavor is, we talked about founders, scientists, and operators. Right? In healthcare, it becomes even harder because now you have a practitioner who's not exactly an operator, but who has the veto. Right? Part of the reason why medtech industry in India struggles is they say, well, the hospital is the buyer, but the doctor is the user, and the patient is the beneficiary, and the payer is the insurance or the government or the family. So that becomes a very, very complex thing. So again, if you don't build capacity in this area, right, which is, the enterprising nature of it, you will have the same situation, and when it becomes 3 lakh, 4 lakh crore, which it will reach, because healthcare typically grows in India, healthcare is growing at almost twice the GDP, right? So it's about 15%, in some cases even going at 18 to 19%. So we set up this incubator in 2016, and today it has generated close to 70 companies, many of which have actually reached the global markets, right? So the kind of support that we are receiving is not only making impact, a visible impact which you see, it is building capacity in a manner that will benefit India over the next 15, 20 years and much more. So what I told you was what I call is the next 5-year horizon, 3-year horizon. Right? But there is today and there is tomorrow. So you have to also build technologies where you're not catching up, but you're leading or maybe even defining the area. So one such opportunity came up about 7 years ago, 2018, 2019, when Chris Gopalakrishnan, one of our distinguished alumnus, who sort of challenged, IIT Madras in a sort of a very casual meeting, that can we do something in brain where we can lead the world, right? And he had a very important observation, and it's quite stunning. He said, human brain sciences as a field itself is quite behind. So if you take neurology or neurosurgery, I ask for forgiveness if you're in neurology, right? It's almost like 30 years, 40 years behind. It's where cardiology was in 80s, I would say, maybe at the best 80s. Like the last significant, advancement in imaging happened in 1984 in MRI. Right? So even today, many pharma companies don't go after neuro because it's a very hard problem. The science itself has not developed. So here a very important observation saying, if the whole field is quite behind, can we actually conquer some of this white space and create something? And out of that is what is the Sudha Gopalakrishnan Brain Center that came about. And today it has become a world-leading center in imaging human brains at cellular level and mapping them. So much so that it had a major, endorsement from one of the Bibles of neurology, saying India gets a seat at the high table of human brain cartography. And this is what we do. And, I urge you to visit the center whenever you're here. We take human brains, right, after death, so you're all safe now. And it's acquired in an extremely high quality manner, and it's imaged at 0.5 micron resolution. So I won't go into the details, but as you can quickly imagine, this is what you call a very high-tech problem solving very advanced sites. So it's a very rare situation. Normally when you do high science, usually the technology is available. Right? You use an existing equipment, you do scientific research. Right? But here we took a big risk saying we will build new technology so that we can do very advanced scientific research. So you could have failed on either of the counts, and we have succeeded on both counts. And this is an important statement, right? This is such a long-standing problem that Francis Crick, who won the Nobel Prize in 1963, had made this comment in 1993, 30 years later after he won the Nobel Prize for the DNA, saying that, we really have not seen the brain in detail. And without seeing the brain in detail, and not just one brain, you need to see enough brains across enough diseases and ages, we really cannot understand. And that's the situation, we are in today. So we built this platform. And today this platform is not only world leading, it's operating at industrial scale. So if you come in, it's operating almost 20 hours, 6 days a week. We built this platform which can take in a human brain and freeze it and slice it at 10 to 20 micron level. And this is a hard problem. If you're slicing something very thin, very large, it's a physics problem actually. So we solved it through both research and a lot of technology development, and image each of these at half a micron. And when you all put it back together, you will be surprised that it leads to petabytes of data per brain. Even in today's AI world, petabytes is a lot. And today we are sitting at an extraordinary opportunity where we have perhaps the largest primary data of one of the most complex structures in the world, which actually has a direct implication on AI. We did that. One of the things that we always, India gets criticized is, we don't take big risks. Like we take risks, but we sort of hedge it. Right? Here we took a very big risk because while we started this project, the world was doing mouse brain mapping. Mouse brain is about 1 centimeter cube, right? About 0.8 to 0.6. And we said we will do something at 1,000 centimeter cube. Right? In fact, the proposal went out to almost 40, 45 people across the world, and the principal scientific advisor's office, Professor Vijay Raghavan, pretty much everybody said this is too ambitious for India. It's a very interesting comment. Right? And the credit goes to him and Chris Gopalakrishnan to sort of take the plunge, saying that let's take this risk. Right? And we took that risk, and today, because of that, we have leapfrogged significantly, and we are in a position where we will be the first in the world to have mapped human brains across lifespan at cellular resolution. Right? So that's something for us to reflect on. And I guess this is the first meeting I'm actually stating this publicly. So we have now set a very hard mission. Right? In this 80th independence anniversary of India, we will complete this mission and release this publicly, right? And so anybody who wants to be part of this, we are really will be happy to have you. And the most important thing about this is instead of hoarding this data, we are making this data public to the world, not just to our collaborators and friends. And that has really caught the imagination of the world. And today, this center has become truly a global center. Close to 40, 45 global collaborators are working with us. And it's one of the examples of where you can do transformative science, but through advanced technology R&D. And the other aspect that came in because of this, it's a very uniquely funded project where the government put the initial seed risk, right? And since then, it has scaled completely on private and philanthropic money, right? And this very rarely happens in science, right? So we always associate science with government funding largely. And here is a situation where something was started by the government and today it has been scaled significantly by private and philanthropy. I kept getting asked when I go to other IITs, can you distill this, right? Obviously, you can't distill something very complex. It's always can be misleading, but I've made an attempt here. What has worked in IIT Madras for the last 15 years that has put us in this position is, I would say, when we choose problems, we seem to choose, either it should be impactful, it should reach people, or it should be damn hard. Right? And either ways, the effort leads to something that pushes the country to the next level. That's perhaps the first thing I would say. The second aspect, which IIT Madras is always known for, is not working in a silo, truly bring people, stakeholders, much, much early into the game. Right? Else you cannot deliver products that reaches people of this kind of volume. And the third one is somewhat related to that, right? I mean, you can't just bring in people, but you have to have that persistence to really go all the way. And at the end of the day, you really need people all kinds of different kinds of people working together on a single mission. So these are the factors that I feel that has actually made this work. So these are the sort of a high-level overview. Instead of 5 people talking, you have to suffer 1 person. So thank you very much.
Thank you, Professor, for your insightful address and for sharing your inspiring work with us. Request Mr. K.K. Raman, IIT alumnus with rich corporate experience and founding member of IIT Madras Alumni Charitable Trust. He has recently awarded with Distinguished Service Award at IIT Madras. Thank you. May I have a round of applause, please? Thank you, Professor Mohanasankar and K.K. Raman, sir.